Very good evening to everybody, and welcome to another amazing episode of The Different News. Today, I am very proud and honored and privileged to have Professor Dr. Murthy CHAVALI with me. And thank you so much, Murthy, for I know how busy you are, and for giving this opportunity to learn about your journey. And we will talk about something which is buzzing here all the time in this world, about something called as nanosensors. So thank you for accepting my invite and being a guest on my podcast.
Thanks for having me.
So, of course, Murthy, I have a lot of interesting questions to ask you because I want to learn from you. But before that, I know you have an extensive career. So we'd love to get inspired by knowing your journey right from where you started and where you are today. Yeah.
Okay, I started my journey to be a doctor, which I couldn't. And then I started to get into biochemistry and neurobiology, which also I have to admit that it was not up to the mark. Then I became an analytical chemist because of my professor who suggested me the skill I have in analyzing at low concentrations. That's what he put me through with rigorous testing and all. And I completed my M.Sc in analytical chemistry and then environmental engineering. And further, during my PhD program, I was about to complete my PhD program where I was suggested by one of the top stalwarts in education and research from NPL, former DG, who is no more. He suggested me to get into Commonwealth Fellowship Program. With his advice and his recommendation, I went into Commonwealth Program. And again, problems do come at every stage, which I couldn't start even after 1 or 2 months. Then I went to Germany and Austria, where I was successfully able to complete my PhD in chemical physics. With that support and experience, what I had in Austria especially, I was pushed to Lawrence to the Berkeley National Laboratory to do some work to understand something about analytical applications using different types of sources, synchrotron radiation sources, with which I started my journey and then ended up in fiber optics in postdocs. And when I was lecturing in France, I was observed by one of the professors from Japan, where he invited me to get into his department of mechanical engineering under JSPS program, where I ended up in completely different field of mechanical engineering as a postdoc, where I started to pursue my chemical analysis experience in mechanical engineering, where it gave me a lot of experience and handheld support with the different types of advanced instrumentation. And also it moved into a next level where I can hyphenate new techniques, 1+1 into 2, so that I will be able to produce a new type of sensor or machine or device, which is applicable for engineering. From where, during that 2-year program, I was asked to work on Formula One engines, Ferrari, and then I was associated with Nissan and Renault and Ford as well. And this particular experience moved me back into Stanford in association with Japanese universities. Plus, that also led me my way to get into NASA for 3 to 4 months period, which is completely new area where it is called as fluid dynamics, which is completely unaware of this particular topic. And after serving there for 2 to 3 months, I moved back to Japan to work in real applied chemistry. And we developed some cholesterol sensors, some typical synthesis of different novel materials for these sensors, and moved back again to Taiwan with the confusion that I need to go back to MBA in Belgium or not. Then finally succeeded to move back into chemistry field where I want to sustain for a longer periods. I started my career in environmental chemistry in Taiwan, postdoc, but ultimately I was ended up a invitation from a Ministry of Taiwan, where I started my lab as a sensors researcher, and then followed by head of the sensors, and so on and so forth. Finally, from Taiwan, I moved for some time in Australia and then came back to Taiwan, heading R&D in an industry. That also gave some experience for me because that is the first time I'm getting into an industry setup where I was able to uh, replace some of the instruments and put them with hyphenation into different new types so that it can be increased in performance. At the same time, it can be identified by new colleges which are coming into research and so on. And so ultimate goal is to improve the sales of that particular industry. And finally, I was in Singapore lecturing for one of the seminars. I was invited back to India by VIT, and that's how I started my career in India in chemistry, not in nanotechnology, but in chemistry. And that also, I mean, I thought, why I have come back to India instead of doing nanotechnology abroad? Because that thing, something was demotivating for me because working at top class laboratories, NBNL and Stanford, and also some association with Caltech. Maybe I thought this is not the idea to get back into chemistry in India instead of nanotechnology. But somehow that worked out. I was able to meet and get in touch with our president, Dr. Abdul Kalam. So he motivated me and he asked me move to one of the research areas in nanotechnology. And he asked me to start from the scratch, starting B.Tech, M.Tech, and Ph.D. program in Nagarjuna, Tamil Nadu. I obliged his decision because we cannot say anything to him because he is the ultimate authority and he gives us guidance and he supported me a lot, with which I was able to start the nanotechnology program, which is given for 6 years. But I was happy to say, and I was able to complete some of the projects and the targets given to me in Tamil Nadu by starting B.Tech, M.Tech, and PhD programs in nanotechnology at the same time, establishing 6 to 7 labs in nanotechnology. And it was up and running in 4 years. From there, I came back to my native place, which is Andhra Pradesh, after 25 years. And I started serving with my past experience as director of Center of Excellence and at the same time, Dean of International Relations, Senior Professor, and Nodal Officer for government agencies, state and central. That's how I started in my native place, which continued for 5 years, then moved back to another college where I was heading a PG program as director and putting them into research. That led to NAC A plus grade for this particular college. And after that, I served for a few years upon invitation in Bangalore. And finally, I ended up in Pune the last 3 years, where I was typically looking into Dean of Research and Director Center Research Facility, which I've established for a period of 1 year. Overall, some 17 labs have been established throughout India and abroad in analytical chemistry, and all of them are up and running, revenue generation through consultancy projects. And of course, I'm happy to say more number of analytical chemistry students have been produced and serving in different capacities worldwide. And I'm happy for that. This is in short about me from B.Sc to the Dean of R&D and Dean of International Relations. And another important thing which we were able to do as Dean of International Relations for a period of 5 to 6 years, I was a part of Homi Bhabha Center for Science and Education and Research, where they put me as a zonal coordinator for South Zone to promote science. That gave me a lot of impetus so that I will be able to speak as an invited speaker for Inspire program. Now that is not happening because most of them are being called from IITs and NITs. They stopped calling from private universities, but that gave me a lot of that impact so that I want to do the real world application in terms of real experiment for the students. And I'm happy in 4 years times, I was able to send almost 189 students plus 25 faculty on student exchange programs and faculty exchange programs for 6 months to 1 year program. And all of them come back with the flying colors. And the beauty of this is none of the faculty and none of the students have spent at least a rupee from their pocket to go back and come back to India. And this is what happened when you have a strong research collaboration and networking with international communities in aiding our research in Indian universities. That is one of the best part I always speak upon in various platforms and various stages. And recently, 2 years back, I was talking in Delhi about research and what is the difference between research in South India and North India. I mean, it's a difficult thing, but still, we were able to address some of the problems of colleges that are being specifically being faced in research programs. So, in such a way, I was able to push something from my side towards sciences and trying to have in connecting link between sciences, applied sciences, engineering, and technology. This is one of the task which was given by the DST for me to speak on for some period of time, along with the challenges and new directions in science and technology. That's how it went on over a period of 30 to 35 years, and now where I am. This is interesting.
Amazing. I mean, that's the only word that comes out from my, I can only say that much, but it's your career is like an inspiration, and the kind of pioneering work you have done. I think we need more education leaders like you. So, thank you so much for doing what you do, and thank you for sharing your journey. Yeah, so Murthy, like since we will be talking today more about nanosensors, we keep hearing about nanosensors here and there. But for me, I come from a clinical background. So for me, most of the time, what we see in our system of healthcare is that once we have the disease, then we have a lot of things to talk about or do. But what about if we can catch certain diseases quite early, even probably, if the symptoms are not showing up, probably, kind of in the molecular level, if I may say that. So, is it possible, or could nanosensors make this type of a thing possible? What would be your perspective on that?
Yes, it is very much possible. Earlier, we are talking about ultra low level sensitivity during my PG program. But what is ultra low level sensitivity? Maybe we talk in ppm, ppb at the most. But when I went to Europe, they were talking about parts per quadrillion. We are way back in analysis. We get a small sample, and again, in that we need to measure in parts per quadrillion. So we need to acquire our own sources, what is available in house, and then we need to develop so many of these things, integrate, set the pattern, set the layout, change the sources, change the amplifier, change the detector, so on and so forth. Like that, we were able to detect parts per quadrillion for few times, not exactly regularly, but parts per trillion is very common. Parts per quadrillion is very rare. We used to detect once in a while because we need to see so many physical parameters, so many chemical parameters, and also our mood levels, and so on and so forth. And it is completely different from chemical analysis to biological analysis, because biological analysis has a lot of interference compared to the chemical analysis. And that is one of the important thing. Somehow I ventured into analysis, and then it went into sources as a postdoc. Then it went into transducers development, like fiber optics and hollow waveguides. And then it went into mechanical engineering, where I was able to develop some of the detectors and the wedged optics. So that these all the parameters, by playing with in a different way in different layouts, it will be able to detect in parts per quadrillion levels, parts per trillion levels. But when it comes to biology, biomolecules, it's very, very difficult. Maybe the same setup what we detect at parts per quadrillion level, we may not be able to detect in parts per million as well. So this is one of the important things that we faced. If you remember, we were working during the period of SARS, where severe acute respiratory syndrome was in. During that particular time, I have transition from Japan to Taiwan exactly in that particular 6 months period. And we started working, but it is very difficult. We don't have safety gloves, so on and so forth. But still, we thought of working on this particular thing. Since we are from the materials background, we have a pattern to test one by one. And finally, we ended up, this is the material which is going to work for this SARS sensitivity detection. So we ended up with this particular material, but again, biosafety came into picture and we were asked not to pursue further with that particular material because we don't have any safety standards. That is where we started working on this particular thing. And we started with biomolecules, SARS, and we have some play to work with COVID, and we have published 3-4 papers on that. And yes, anything we talk about biomolecules, with the nanosensors, it is very much possible nowadays. Either resistivity sensors, or electrochemical sensors, or connectivity sensors, or AFM-based sensors, or in combination with electrochemical and AFM-based sensors, and so on and so forth. And I can give you some of the examples like SARS, and we started working on PSA, prostate-specific antigen, and we also did some work on some of the biomolecules where we integrated capillary electrophoresis with a vertical cavity laser and then laser-induced fluorescence. All three put together, we evolved into a different system. The ultimate goal is to detect something in the range of zeptomole, 10 to the power of minus 21. We're not talking about nano, we're not talking about pico, and that is mainly because to overcome some of the interference that we get during the process of our analysis. And we have succeeded that into, I mean, almost the size of 5 meter by 5 meter setup. And finally, we ended up making it into 5 centimeter by 5 centimeter setup, where we were able to detect septomole concentration of this biomolecule. Same thing we extended to PSA, that we have done it, and also we have done with some of the molecules like epinephrine in 2 types of ways of analysis of this particular thing, paracetamol, and some of the drugs for hypertension, and also for anesthesia, different levels. Almost 13 types of drugs were analyzed in conjunction with biomolecules. And all these things led us to identify before the disease arrives, the pre-symptomatic characteristics can be done with this nanosensors technology only by modifying a little bit. That means we need to understand what exactly it is happening and what are the types of things that we are going to look at, the category of drugs specifically, or the biomolecules, so on and so forth. So this is very much possible with the nanosensors at ultra high sensitivity levels. And also multiplexing is also another thing where we can detect 4 to 5 of these particular entities within no time. So it is very much possible. And this can be taken into the next level also, because people are working based on these nanosensors. People are working with nano GC, nano LC, nano MS, so on and so forth. By hyphenating these things with the data that we get, we can, from nanosensor, we can get into wearable technology, and from there, we can have precisive, pragmatic decision-making algorithms using AI to this, so that from 80% of detection to probably we can give the accuracy levels to 98.5, which we already achieved in HIV analysis.
I mean, that is, thank you for the comprehensive answer. And I think you showed all the layers that we can get into, because I think more of awareness, particularly for not the scientific community, more about the awareness towards the healthcare society, I should say, that we need get exposed to this kind of a knowledge, because particularly when we come from the medical background, and we are also not having this kind of an exposure. So if we are to have to do clinical research, so I think it's a two-way information that needs to be put out.
Going to be complementary.
Yeah. Thank you, Murthy. It was very interesting. As you were speaking, it was just running in my mind. Like we talked about biomarkers and stuff. So, what kind of signals? Particularly, I'm talking about biological signals. What kind of biological signals do actually nanosensors detect, and how early in the disease process that this detection could be possible? Because that is very very important. Because today we are into the era, like as you rightly said, we can take AI and build so many things, but when it comes to early detection, these are the things we need to understand. So can you help us understanding that?
Yes, this is one typically important question. Before we say what is the exact biomolecule that we identify, we try to understand the procedure and the disease itself. That's what we do. For example, in case of, I was invited once to one of the semiconductor industry. Their production has come down drastically to 60%, completely from 90%. So there is a change in 30%. Why? Nobody knows, because there is no problem with the machinery, because we always tend to look at the machine where the fault line is. And then there is no smell, there is no leakages, and there is nothing. There is no visual thing also. We tried to do that specifically for one complete day. We understood nothing. Accidentally, what has happened is the exhaust of this is one of the clean rooms. So we cannot put in anything new, anything foreign material into it. So the flue gas, which is coming out, it's a normal non-toxic gas, which was kept outside. Somehow it was corroded slightly and it was bent upon. And the direction of this is towards the fruits of the food material or the canteen area where it was being kept away from the main clean room. So the next day we have noticed the ripening of the fruits. Then we understood there is some gas coming emanating from this, and finally we have identified this as ethylene. And this ethylene is ripening the fruits at the other building because it was connected through hoses, and that was directed towards these fruit chambers and so on and so forth, somewhere where they have dumped these particular fruits. So we understood, and we asked the candidates when it was kept. It was kept yesterday, and what is the status of these fruits? He said they are very sweet. Yesterday it was not. So there is a formation of esters, and we have identified it has been ripened very well, excessively rapidly. So this means typically there might be some gases of ethylene. At the moment we tested our ethylene gas sensing, we found huge amounts because we were already working on this particular ethylene for transporting fruits and flowers from Taiwan to Netherlands. So over a period of time, if the concentration of this ethylene is high and the destination is 3 days apart, what we try to do is we inform the shipment immediately to dump them at the nearest places so that we can save the revenue. Because this sensor is connected to RFID tag. From there, we get a signal. This much concentration of this entire ship is going to lose. You will be wasting the fuel. At the same time, we will be wasting the stock as well. So we are already working on that for agriculture purpose, transport, grade, and etc. etc. That went into our mind. We were able to identify this particular gas. Similarly, when we are working on this hyphenated techniques for biomolecule, we are not worried about. We are actually working on different ELISA techniques to identify. And at the same time, we don't want to understand what exactly the biomolecule is. All we are worried as a chemist is the signal with which it is coming, from where it is coming, how far it is coming. So we have identified the problem in capillary electrophoresis is the movement and separation of these biomolecules, different types of biomolecules. So we were asked to address something which is being fluoresced. So that is coming at a later part. Initial part, everything is flowing through this particular nanochannels. So that means we are trying to identify this as a high molecular weight material. So we concentrate on this high molecular weight particular molecules, and what are these have been studied by biologists. And these particular high molecular mass has been studied further, from where we were able to identify this is the protein, this is the myo-related something, biological data. In that way, we started identifying. Now, after this particular process development, biologists will say, we want to identify this tau protein, amyloid protein, so on and so forth. But they exactly know why this has been identified. They know that this is being there so that this acts as a biomarker for this particular compound or for this particular disease, and then so on and so forth. Like that, we were able to identify by trial and error methods of analysis and trial and error methods of different types of segregation methods, so that finally we cornered one of the protein or biomolecule, so that this is the biomarker that we are going to look at. So that if this is present, this type of disease is going to come within 1 or 2 years or 6 months. That's how we undergo the procedure, and finally we identify this as a biomarker, typically like prostate-specific antigen.
Thank you so much. I mean, this is so interesting, like, because I think this kind of technology, particularly if we understand, I mean, if there is a handshake between the biologist, the healthcare people, as well as people who are developing, I mean, scientists like, of course, bioanalytical scientists, if I may put like that. So I think this combination is deadly and very much needed when we are today talking about so much of making disease diagnostics easy. So I think this revolution has started, but I think the gaps that still exist would be filled when we become open to more collaborations and I would say multidisciplinary approach.
Of
So
course, we should not neglect or ignore data scientists,
yeah,
statisticians, AI.
absolutely,
Because
absolutely.
2 years back, we got a collaboration from Egypt, and we were asked to collaborate on environmental, analytical chemistry, and AI. AI, we don't know anything. Literally, we don't know anything. And then we took some of the help from other nearby colleges like PES University, Bangalore, REVA, RV, and of course, Dayanand Sagar. All these universities, one student each and one professor each, and myself, we were able to produce on typically on AI related to these things, nanosensors and other materials. And I'm proud to say we have 6 to 7 papers
Wow.
published in this particular area in 1.5 years. I mean, credit goes to networking and collaboration, and everybody got the name. Same thing happened earlier when we were working on different types of chemical analysis methods at parts per billion levels. Somehow we met a doctor from WHO, and he said we are having a problem with anesthesia measurement. What exactly it is he's a PhD in medicine, anesthesiologist, and a mathematics professor. So he had a deadly combination with him. But the point is, he's no chemist. He wants our support to do the analysis. He said, anesthesia, why wouldn't you analyze this anesthesia? I said, why do you want to measure anesthesia? Because we just give it to the patient and we go out, that's it. Oh, why, what is the impact of this particular measurement? Then he suggested, see that when in OR, the doctor comes beyond limits. I mean, 4 units means he will administer 5 units of anesthesia. What is happening to that 1 unit? It is still remaining in the operation theater. Patient after the operation, he is gone, he or she is gone. Doctors are gone. And the problem is the support staff. They are inhaling that 1%, 1 unit of anesthesia over a period of 8 hours, and it remains for 2, 3 days. And second day, another patient comes, it sustains for 3 more days. So typically over a period of 8 year data, what we have collected, it is really creating a lot of trouble to the support staff who are moving in and out of this OR. That is the cause that they ask. Okay, measure it. Yeah, measurement is a problem because they need a hyphenated techniques, which will cost 2 machines to hyphenate with each other. And the cost during that particular era, 2003, 2004, it was coming to 2 to 3 crores of machine. And definitely hospitals cannot have this type of materials and machines. So we were asked to do some work on that, and we were able to produce vaguely, accidentally, we were able to detect this anesthesia ups and downs, not exactly a precise measurement, but some signal which is coming out using a pH meter. Used waste thrown out pH meter. We have recircuited it and we kept it within the bell jar where we are doing the crude measurements. And the signal is coming up and down, up and down. Immediately we published the paper with the same crude results and it went up to 7 impact factor. And then we started 3, 4 types and we went on to buy uh, additional amplifier and a specific meter, which costed us some 6 to 7 lakhs. And we were able to produce precise results up to parts per ppb for at least 6 of the anesthesia. And that created a hype. GE immediately called us and identified as one of the groups in the top 3 in the world for anesthesia measurements. And we are very happy for them. And we got some revenue for that as well. And this revenue generation is another story, but we were hyped into such a level, and our team was invited to USA to come and work with GE in developing these anesthesia sensors. But the anesthesia sensor, what we developed is for Taiwan, and they have given additional 13 more drugs to develop different methodologies. And our methodology is coming around 1,500 rupees per sample, and the shelf life is also 3 months. So it is very, very easy for them to monitor. So coming to the revenue generation, we got the revenue, and that led to another technology from our side because we failed in replicating the same sensor next month, and people laughed at us. We published
Okay.
6 papers, we failed to reproduce the same. We never understood what is the reason behind that. So we started to dig from the scratch. Well, the only difference is we changed our lab to old building to new building. We never understood what exactly is the problem, but that is the biggest problem. In the older building, we're using sodium lamps. In the new building, we are using LEDs. LEDs are interfering in our reaction, and it is causing the chemical not to polymerize. For this, it took almost 4 to 5 months period to identify this particular problem. And after
Nice.
that, we came out in the flying colors. 2, 3 people got graduated with their PhD programs. And then that led to UV-induced photopolymerization, coining of the name of this particular technology. And we further able to do some of the additional work for sensing and polymerization and biopolymerization for biotechnology departments or nanobiotechnology departments. So it all comes with problems that emanate from others, and we try to solve them. We understand the procedure, and we try to reduce from macro to micro level, from micro to nano level. We bring in the entire layouts. We change different components of this particular device so that it will be able to detect, store, and now that we are thinking of adding AI component, extra component to our devices so that it takes care of everything in sort of the memory, and then it recreates its own decision, which will be compared to human decision. Because industry is also going into industry 4.0 to 5.0, from refinement to implementation of human instrument collaboration. So if that is there, these things will go into the next level as decision making and precise calculating of the concentrations of these particular biomolecules.
I think this sounds to be like I'm watching a sci-fi movie, and you are just telling me stories about it. But what a beauty of science! And I think as scientists, it's always like that, Murthy. Like we think many critical things, but we miss out sometimes. Many a times we miss out the
Yes,
small things
yes,
that is in front of our eyes. So just
yes.
shifting from old building to new building, it gave you just opened the doors in a completely different way. I mean, who
It's
could have
completely
thought that?
different. During that particular period, it was total embarrassment for us. It's a
Yeah, of
3 minute
course.
work, it was just not working, and people are
Hmm.
laughing at us as if we have given some wrong results, manipulated results. But still, we got 2 projects, research projects. One is equal to 22 crores in Taiwan
Wow.
Canadian project that went into breath analysis program, alternative for detecting the diabetes
Yeah.
patients. So in that way, we were able to do, but this kicked us a lot. But we literally sat on that. After 4 or 5 months, we were able to identify. We shut off the LEDs. 3 seconds, we got the peak on our screens. Same experiments.
This is really, it's like a really a fantastic story for, to
Yeah, we were
digest.
really.
Yeah, absolutely. I mean, it comes with, because we do so much of work, and like those backlashes, uh, it really hits hard, of course. Yeah.
Yes, it was. It was. That is the bad patch of our career for 6 to 7 people who
Yeah.
are working. But of course, after that, we raised to the mark and
Yeah.
then we produced a lot.
Amazing. So, one more question, if I may ask you, like when we are talking about nanosensors and of course detection and stuff, so yeah, does it depend on the biology, or rather does it depend on the pathology of a disease? Meaning to say, for example, if I may put the question in a little bit in different way, that what way, like how can we detect, say for example, diseases like cancer, infections, metabolic disorders? So what I'm trying to understand from you is that, are there any categories like this where the nanosensors detection would be better, or how is it? I mean, how is that?
No, I don't think it is any difficult job. When you are trying to look at the symptoms, oral cancers, for example, it has multiple symptoms which is coming out,
Yeah.
uh, visualization, color, and accumulation of load of this particular bacteria and so on and so forth. If you are able to connect one of the parameters with one of the types of the cancers, then you are done. Because this comes from my experience. When I completed my master's program in 1993, I was sitting idle in the department because I have no place to go. I'm a hostler. So my boss identified me. Okay, you have to give him something work. So he simply said, collect all the mineral water bottles, sealed condition,
Okay.
analyze them. For what? Then he said, analyze for metals, which is your priority area. So I've collected 13 bottles, 13 types of mineral water bottles, pre-concentrated them, and then we have studied the metallic content of this particular thing. What we found out is astonishing. The so-called mineral water bottle is not a mineral water bottle. It should contain some minerals, no minerals. Instead, it was directly collected from springs. We know the origin of these bottles also. For example, one of the top hilly area where it has a spring, simply collected by tanks and put the label, sell it out. Means the cost of the bottle is going to be 1 rupee and you are being paid 25 rupees for that. This is what we understood, and everything has been published with results in newspaper. That created hell. That is exactly before uh, Center for Science and Environment published pesticides in Coca-Cola,
Ah, okay.
1997, 98, during that particular period. We did it in 96, 95, 96. And that created shockwaves. And they came to our university. Who did this? Because name was also published. They identified me. Almost I have to give some 7 to 8 interviews. And the ultimate question is your analysis is good enough?
Mm.
That's the first thing I was targeted. And then we stopped it. We don't want to get into any of these particular issues. Of course, CPCB is there already to look into it. Then we got a good name in Hyderabad for this, and we were receiving some tissue samples. We don't know where it is coming from. My boss gives me, and I analyze.
Okay.
Nothing, no questions asked. You have to do it immediately, as early as possible. Okay, fine. After 1 month, he started to tell me where the tissues are, what are the type of tissues. Then we came to know these are cancer samples, tissue samples. And of course, we have a habit of writing lab notebook. For
Right.
some reasons, I used to maintain that. Still, I keep my lab notebooks from 1994. Still, it is present with me. And
Wow.
when I started to write everything A, B, C, when I correlate that with this hospital, cervical cancer, skin cancer, lung cancer, biopsy materials, and so on and so forth. Actually, we put everything into one sheet, which is not fitting. Then we transferred everything into Excel sheet. Everybody laughed at us. What is that you are doing? Why are you wasting time? You finish that
Hmm.
analysis, close that. But ultimate point that came out is we were able to correlate. If it is cervical cancer, only these two metals are very high. You can be diagnosed just by seeing the data. This is a female patient, cervical cancer, and then at what stage? Second stage, third stage, we can say. That correlative sheet gave us inputs about the patients without seeing them, without understanding what they are, what is the state in which they are, so on and so forth. So, similar to that, when we use statistic methods and mathematical methods and Excel correlations, we will be able to identify. So now that based on this, we can identify, just study the magnesium levels and calcium levels in cervical cancer patients. Then you know. To have a precise machine, earlier we are using atomic absorption spectroscopy. Now we can use ICP or ICP-MS, direct, one shot. All metals in 2 minutes, you'll get it up to ppb level.
Wow.
Precise levels. Then you can identify immediately one, two, three. These are the two prelim cases, second stage, third stage, and so on and so forth. If it is working, if you are working for cancer patients as a biomarker or something like that. So similarly, we will be able to identify so on and so forth. And sometimes if we cannot detect this particular thing, this can be either masked by removing the rest of the things, or it can be coagulated by something else. So A is reacting with B. We don't know what is A. We know B. B is 2%, and this is subsequently it is going to be 2% or 3%. Indirectly, these at the lowest ultra high sensitivity levels, we will be able to correlate and identify that particular biomarker so that you will be able to do using nanosensors. You cannot do it in macro machines, but still at the nanosensors, because they are very fast, probably gives in a few seconds to a few minutes maximum. That's it. It can be done. These are some of the things where we have associated. We have associated with skin that is being treated with IR, UV, and we have done with prostate-specific antigen. We have done with cancerous materials, cancer prevention materials as well. And for prevention, what we have to do? We have to give a localized treatment. Again, connecting this with the nano bomb or nano vibrations, or that is related because of heat treatment or something. We
Okay.
simply call it a nanobomb. How do you initiate nanobomb? It's a very localized area. I mean, this is an alternative for chemotherapy.
Right.
So this
Amazing.
material, this nanomaterial is being given to that carcinoma tissue.
Mm. Mm.
Then it explodes. How it explodes, it depends on you. What are the methodology that you are going to implement? Whether it is going to be uh, directly triggering the mechanism, or over a period of time because of heat you are triggering the mechanism. That depends on this type of stage in which your cancer is in. If it is nothing, just play the UV rays to this particular nanomaterial and it explodes at the localized level, and see how much part of this particular cancer has been removed, or is it affecting the healthy tissue, so on and so forth. all these things. And last but not least, we have identified try to neuronic disorders when there is no connection between the neurons, synaptic phase is
Yeah.
being affected. That
Mhm.
particular thing, we can functionalize these nanotubes, and then we can able to develop the connection between these two using these functionalized nanomaterials. We were able to achieve 30 to 35%, not beyond that, because toxicity of this nanomaterials, nanotubes also will come into picture. So we have to study further and so on and so forth. We stopped at that particular level, not to get into other unwanted things. Still, these are some of the areas that we have worked, and we are trying to enhance the sensitivity, reducing the cost, reducing the time, and at the same time, simplifying the procedures using combination of physics, chemistry, and biology.
I think it's for me at least is very mesmerizing this conversation itself because I can visualize what you are talking about and the way we are going ahead and the kind of work you are doing because I think in today's world with technology being advancing so fast these things are again it won't be just published and logged in a paper but I think more of translational research and product development we can
Yes.
look into. So I have another question. You might, I mean, we have discussed like before our podcast, so you know that I am a little bit of interested more towards saliva as a sample. So it always
Right.
triggers my mind because it's such a powerful sample, and always say it's unexplored, and it hasn't gotten its uh, limelight that it should have been. So when you talk about such a in deep level identification detection of and quick and kind of it sounds very simple. I can understand what the background work would be, but it gives me some kind of promising aspirations when it comes to saliva based testings. So how close are we uh, at this moment that we can actually integrate nano based diagnostics with saliva testing? Because honestly, for many things, not for everything of course, but for many things, this would become a game changer. So any thoughts on that, Murthy?
Yes, it has become already a platform for some of the tests. Example, drug testing, uh, alcoholic tests, and people are using it for diabetic tests as well. And at the same time, some of the cancers, neurological tests, which are just upcoming, up to 80%. HIV tests are already in place, but still, people are trying to do some of the tests to unleash the entire potential of saliva in a simple way for non invasive, low cost, ultra fast, high sensitivity testing. So, in that sense, people are very much trying to use it for STDs and breath analysis, Parkinson, Alzheimer's, so on and so forth. And of course, dental dental sector is one of the most important thing. They can say dental caries and maybe oral cancers, periodontics, and some of the syndromes that are related to dental and connected to neurological. So, in that sense, it is going a lot. But multiplexing is one of the areas where they are already doing, but there is no actual platform to multiplex different sectors. For example, dental, STDs, neuro. There is no common thing which is emanating from these particular doctors. If that has been achieved with people in California, they are trying to have a single platform for different things. Platform in the sense you have a one strip to do dental work, another strip combined together to do these things, and some to identify virus, some to identify bacteria, and some to identify other unwanted materials. Even inflammation can also be, uh, hormonal changes can also be detected by using saliva test. But it was not completely confirmation test that has been emanated, because it's not because of the test, but it has to be approved by certain bodies and societies. Then only it will be approved. So people are coming up. For example, in the case of chemical analysis, for example, what the problem we face. I was doing some gas analysis with one source. The source has to be picture clear with only one single peak. Then only we will be able to get PPB levels. But somehow my source is coming at two peaks. So literally two peaks of I can see. We tried. We could do nothing. After 1 month, I suggested to my boss, why don't we say is a dual analysis setup? Two analytes can be analyzed with using two peaks. Then he said, that's a good idea. Why don't you propose it? We got €500,000 on that.
Oh my God.
After €1 million at 2 PB levels, using a sample of 2 cc, we were able to do this. And the technology what we have developed has been transferred to one company in Munich, and he gave us a lab worth €2.5 million. So this is how we try to understand, we try to analyze, and then we need to proceed in such a way so that same amount of data, for example, in environmental analysis, total dissolved solids and conductivity, something, some formula between these two. You do one analysis, you'll get the other TDS by multiplying with this particular factor. But results are going to be 95% accurate, not 100%. But still, this is one way of getting the data with the one which is already existing with you. So in that sense, there is a lot of potential where you can analyze insulin-related resistance, you can analyze inflammation, and you can also analyze obesity just by connecting this with the saliva test. Drug testing, drug information, and narcotics information, and about Parkinson's, Alzheimer's. All these things are possible. Even TB is possible using saliva and alternative postmortem tests. And these are mostly highly reliable, but it has to be confirmed with the bodies by, because too many markers, they think that it can interfere and it can give absurd results. But still, there is no such thing. We are getting absolute analysis, and we are able to detect the viruses, bacteria, and all these tests: cancer, lung cancer, oral cancer, STDs, and so on and so forth. You can do many, many things by understanding the saliva test.
Right.
And also another thing that has been observed,
Huh.
what is the time to take the swab for saliva? Morning, evening, afternoon. That also plays an important role. So most of the scientists that they were telling it has to be done in the morning.
Yeah. So, because there is diurnal variations in certain biomarkers, in case of certain biomarkers, there is always diurnal variations when it comes to their presence in saliva, which probably is not that much when we talk about other biological fluids.
Yeah, because you're diluting the saliva,
Yeah, exactly.
and then your concentrations will come down. Probably
Correct.
you missed the bar before and after PPP and PPM. So those things can be avoided. To get to know all these things, it is better to take the swab in the morning so that you will be able to diagnose yourself. Even some of
Correct.
the people are trying to connect this with the sleep patterns. I don't know how far it is true, but still there is some connection. Only AI can help us in solving this.
Today we see a lot of talk on predictive diagnostics. I think you mentioned about Hyderabad, so I think that has become a hub of this kind of precision medicine or genetic medicine, I should say, in terms of detection. I'm talking about. So, right. So the thing is that are we actually really ready for such predictive diagnosis? Because lot is happening. I'm pretty sure that we are in good time. But my question always remains that are our healthcare systems, including the specialists, the doctors, and the patients, are we really ready for it? So that is something which runs in my mind. You being such an expert, coming from an analytical background, your insights will be really, really important and valuable. Would you like to add something
No,
from
I
your
don't
side?
think we are ready.
Mm.
Yeah, I don't think we are ready in terms of infrastructure that what we have, because our doctors, we don't produce any papers. Number one, only few of them, like Ames people and some of the top private institutions, they may produce some of the papers who are in the apex bodies like WHO uh, and so on and so forth. So that mindset has to be changed. And we mainly concentrate on, if you compare the doctors between India and abroad, these doctors who are coming from abroad, who are working abroad, they don't remember any of these particular drugs, medications to be given to the patient. They give the symptoms, immediately it triggers something on their screen that has been given as a medicine for the patients. Our doctors, we concentrate more on medicines, representatives, pharmaceutical companies, you know what I mean,
I know.
and they by heart everything. Instead of that, this amount of memory, which they use it for something else in terms of research, probably there is a chance of growing or giving some other. I mean, if you go to a hospital and if they can treat you in one day, what is that they are going to gain? Nothing. So they keep you stay there for some weeks. They give you a large bill and then they will treat you and they send you out. This mindset has to be changed. If that is changed, and I'll tell you one of the examples. There are different parties in Taiwan. They compete with each other. See, they give you some sort of electronic device to your hand. Something happens to you somewhere. You have to reach the hospital without anybody's help. I mean, no information given by anybody. Only thing is your watch or the tag, which is electronic tag, which is holding onto your left or right hand, has to give that information to the doctor or that nearby hospital. The time between the patient to reaching the hospital is now at 24 seconds. These doctors and this hospital, they fight to reduce this particular time. Does this happen in India? Even 24 days, nothing goes on. Nothing goes. They are all worried about the patient in some condition, better critical rather than initial stages, so that we can extract a lot of money on that. And that's why we have lot many hospitals. In Taiwan, probably you see per city one national hospital, nothing else. You don't see anything. Here we have one city, you have 1,000 hospitals, but still it is not being treated, and so on and so forth. Unless until this mindset is being changed, or it has to change. All you have to address is it has to be fast enough, it has to be ultra sensitive, it has to be low cost, and so on and so forth. New technology will never come into picture. Even if it comes, so-called politicians who are running this particular hospital, they will stop this. They will say this is not validated, it has to be validated. And then it takes 1 or 2 decades. By the time it comes, it becomes obsolete. I can tell you many, many stories. Some of my professors who are working with me, they were unhappy with the system. They resigned their jobs. And I'll tell you, you don't believe. These professors started their own startups. A professor
Wow.
who 300,000 new Taiwan dollars in Taiwan, he stopped working, resigned his job. He started a company. Do you know what is the company? a keychain company.
Oh God. Okay.
I laughed at him. He said, "You don't know what it is. If you think you can go rich by this, no tensions, no stress, you're the boss. You create innovatives in these keychains." And he's a multimillionaire now in 5 years. This is how they grow, and this is how they bring others to grow, and so on and so forth. If anything has to be done, it has to be done in a short period. And in that sense, the main important point is the mindset. If you change that, you can beat everything. And also, the person has to be rightly qualified. A right person in the right job will create wonders. And an uneducated person, because of money, he is trying to tell you what to do. That will
Exactly.
not be a growth track for anybody.
Absolutely. I completely second your thoughts. I know the system inside out. So I think, but still, as a person, as a human being, having so much of clinical knowledge and seeing people, seeing patients around, this is something which always hits my mind that why we, I mean, I'm not against any West or East or India or like that, but
Oh,
why
yeah.
not we? Why not we? That is the question always hits my mind. Why it has to be from all the time from the other side of the world? Why not from India?
Yeah, just take one example, DRDO. Why are we succeeding?
Exactly. Exactly.
Why not in others? Don't we have
Mhm.
the talent? No, we do have. I can give my own example. Everywhere, every private institute where I go for an interview, I mean, now I'm not going. Previously, they used to ask me, why you did not apply to IITs? When you have a good resume, why did you apply? Yeah, I missed it. Somehow I will tell them. No, 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 I didn't miss it. I did apply. They asked me only one question. Are you from IIT? IIT professor will ask me the same question. Are you from IIT? No, sir, I'm not from IIT. I'm from a better institute than IIT. No, 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 I don't care. Are you from IIT? See, if you are
Hmm.
from IIT, then only they say you are the best. If you are
Right.
from Caltech, they don't care what you are. If you are from Stanford, they don't care what you are. This is the mindset. Means you can just by this question you can understand the people who are trying to interview from the other side. All four are not qualified to be in the position. Very simple.
Yeah. I think you're speaking my mind. I mean, anyway, we are kind of going in a different dimension, but I think I think the fact is fact. I mean, we can't deny the facts. We can't keep quiet all the time. So, I personally feel that there's nothing negative or positive about it. It's just that, I think the new generation, and as we can speak more about all these things, it is not about sitting and blaming somebody, but to really solve a existing problem. That, like as you rightly said, the change of mindset. I think the young generation, if we can nurture them well with the right thoughts and direction,
Yeah, I'm
revolutions
not
are.
complaining. I'm not complaining. The point
Yeah, yeah.
is once you let the flow goes,
Huh,
it will develop few more branches.
exactly.
So 20 people coming out from my side or from some university side,
Mm.
there may be 40 to 45 people coming out in the same mindset. That means it is making the nation technologically sound, and we are getting the name. We are developing in every each and every part of the technology, and so on and so forth. That's all. I mean, I used to face. I was in the committee of projects. I mean, some of the questions that you asked, you can't even imagine, which is completely irrelevant. So if you say you're working on biology, okay, let me ask you some question in social sciences. That's what they do.
I know. I know. Oh God, yeah. I think it was amazing talking to you, Murthy, and I think got a lot of fantastic insights. And thank you so much once again for being here on my show. And I think we need to do more conversations because
Sure, sure, sure.
that's how we can at least put some good thoughts in the minds of people who can really execute stuff and who are ready to do that, with all the context. Yeah. So thank you so much once again.
Thank you.